know. Globally, when you look globally, I know some of the folks, actually had a gentleman from Finland the other day that talked about, I made some comment on one of my talks on social phobia about the commercials that the drug companies are using for social phobia and social anxiety disorder. And he emailed a little comment and said, "We don't have any social phobia commercials here." So I always kind of have to keep a global perspective a little bit as much as I can. I don't do that very much, but here's some global numbers. Or stats. The highest suicide rates are in Hungary and Finland, and the lowest are in Greece, Mexico, and the Netherlands. And the U.S. is in the middle. Now, season is another thing. Season is another risk factor. So we talked about seasonal affective disorder in here, and we talked about how when the days become very long or very short, and there's a lot of darkness, and that tends to be a higher risk for depression and then suicide. So places where there are long, cold winters like that, Scandinavia and Alaska, for example, have higher rates of suicide. Occupation is another risk factor, and I think it's probably not something inherent. I think it's the stress that's involved with the different occupations. So police officers have a very high rate of suicide. Why? It's been speculated that perhaps it's because, they work awful long hours. Well, we all work a lot of hours. But besides that, they witness scenes that the rest of us don't necessarily see in our lives. They deal with an awful lot of stress because of that, and the people they're constantly interacting with are not always the most pleasant. They have high divorce rates. They're kind of encouraged. It's sort of how we talk about the stigma in our society. It's even worse in the police force, I think, where they're encouraged not to discuss stuff that bothers them and stress and things. They have quick availability to guns, obviously, right? So that's another thing. And then they have a high rate of alcohol use. So you put all that stuff together, and that's a pretty high-risk profession for suicide. This one depressed me a little bit, actually. Physicians have a high rate of suicide. It turns out that in the United States, the medical field loses the equivalent of a medical school class to suicide every year. And that's pretty bad. And it seems to be physicians that deal with terminally ill patients that have the highest rate of suicide. And dentists also have a high rate. I don't know why dentists would have a high rate, but I remember learning that in medical school, actually. There are some social, cultural, and economic factors, too. Like any kind of economic downturn, and economic depression is even worse, probably because of the poverty and folks struggling to get by. Some cultures, such as in Japan, suicide is more acceptable. So in certain situations, it's regarded as honorable for suicide. Another risk factor is availability of firearms. So somebody who has, like in the United States, of course, it's pretty easy to get a firearm here. Some countries it may not be, but here we have a higher rate partly because of that. They are the leading method of suicide, so it's of completed suicide. Other risk factors, medical illnesses, long protracted illnesses that cause a lot of pain and go on and on, such as quadriplegia, cancer, multiple sclerosis, severe whole body burns, things like that have a high risk of suicide. Again, I didn't put these in any order necessarily, but somebody who's had a history of attempting suicide, and somebody who has a family history of a family member that's attempted or completed suicide, those folks are at higher risk. The family history kind of makes sense to me. I mean, some of these mental illnesses and depression and such run in bipolar disorder and all. They do run in families, and it could be that maybe mom or dad or whoever suicided had depression, and then the child then ends up with depression and then is at high risk for suicide as well. But it also may be that there's some biochemical change or some kind of wiring problem in the brain that's inherited that, besides just the illness, that also brings along a risk of suicide or a higher risk of suicide. They've looked at the cerebral spinal fluid, around your brain and your spinal cord, of people who have committed suicide. And what they found is they have lower levels of metabolite of serotonin. We've talked about serotonin in here before, but serotonin is a chemical that is found to be low in depression. And so it's hard to know, is this something unique to suicide, or is it just the depression, or what? But there may be something that runs in families like that. Interestingly enough, you hear a lot about suicides in one adolescent in a school, let's say, and then there's a rash of other sort of copycat, if you will, suicides of their friends. And it's hard to tell if these kids are all depressed or if it's something else going on. I don't know that I fully understand why that happens, but it's a risk factor. So if a close friend of an adolescent commits suicide, then that's, even though they're not biologically related, that's also something you need to keep an eye on the friends around that child, Obviously, history of physical, emotional, and sexual abuse growing up or in your life at any point can carry a higher risk of suicide with it. And then other psychiatric illnesses. So 95% of people who commit suicide have some type of psychiatric illness. Most common is depression. And the depression can be either part of major depression, just plain depression, or as part of bipolar disorder. And we talked about bipolar disorder in here before. But 30 to 70% of people who commit suicide have depression of some form. And typically it's associated with hopelessness and worthlessness and feeling like there's no way out, with the depression. When those factors come into your depression, that's a higher risk. 15% of folks that have depression will end up dying by suicide. And that's a pretty high number of people. I mean, it's up to that number. There's some studies that show lower than that, but it's up. There are some studies that show up to that number, and that's pretty scary. And especially if you don't treat it, it's even higher if you don't treat it. That number is 20 times what the general population's rate of suicide is. So folks that aren't depressed, it's 20 times higher in those that are depressed. And then with bipolar disorder, it's 20% of those with bipolar disorder that can die by suicide. That's a fifth, 1 in every 5. That's up to that number again. That's the higher end of the number. But suffice it to say, it's much higher when you have one of those illnesses, a higher risk of committing suicide. Schizophrenia, we've talked about that in here before, and they also have a 15% risk of suicide. 15% of them will die by suicide. And interestingly enough, 75 to 95% of them these folks are men. Don't know exactly why men are affected more than women, folks with schizophrenia, but it seems like that's the case. Why is that? I mean, sometimes they hear voices that will command them. We call them command hallucinations, that command them or tell them to kill themselves or kill someone else. Those things, the rest of us think, well, just ignore them, but in schizophrenia, it's not really easy. Those things really torment folks. They also can become depressed, like any of the rest of us. And then sometimes they're paranoid, and then they isolate and withdraw away from other people, and that sets them up at higher risk. Anxiety disorders, we've talked in here before, like panic disorder, post-traumatic stress disorder, generalized anxiety disorder, some of those, they have a higher risk of suicide. And it may be because they're so highly associated with depression, but it's not exactly clear as to why. Folks with personality disorders, they have a 3 times higher risk of committing suicide than the general population. And again, some of these things may be the way the brain is wired, but it also may be the trouble with interaction with other people and loss of job and other things that can come from having personality disorders. And then finally, substance abuse. I told you it was not in any particular order. Substance abuse is kind of a high risk. Not kind of, it is. I mean, they found that 40 to 60% of those who die by suicide are intoxicated at the time of death. So if you got rid of alcohol, I mean, if you took alcohol out of the equation of this, you'd have a lot less risk of suicide. The risk of folks, well, it's 1 to 6% of people who have alcoholism who die by suicide. So it's not, you might be thinking, well, it's just all folks that have alcoholism. That's not what it is. It's actually not very many folks that have alcoholism. It's folks that probably have depression, and then they drink, and then the drinking disinhibits them, if you will. What that means is like if, you know how everybody is when they get drunk. They say and do things they wouldn't normally do, right? Because the alcohol blocks the front part of their brain, which is our social conscience. It gives us our ability to say, oh, I probably shouldn't say that to so-and-so, or I probably shouldn't do that. Well, it also gives us the ability to say, I know I'm depressed.